Thank you for choosing Access On Demand. Access believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, my name is David Hoover, and I am Vice President of Revenue Cycle Management here at Access, and want to have a conversation about the CARES Act and how to access financial assistance and resources from the CARES Act. So first, what is the CARES Act? It is the Coronavirus Aid, Relief, and Economic Security Act. This was done to provide emergency assistance and healthcare response for our individuals and businesses affected by the pandemic. There were 6 divisions in the Act covering multiple areas of assistance for individuals and businesses. $2.2 trillion was enacted into law on March 27th. And we'll talk a little bit about the individual couple of components of the Act that brought about that are related to home care agencies. I want to talk about 2 funding options, the CARES Act related to agencies. One is the Accelerated and Advanced Payment Program, and one is the Paycheck Protection Program loan, which is an SBA loan. So let's talk about the Accelerated and Advanced Payments Program. This actually is a CMS program that's been in existence for public health emergencies. What happened is the CARES Act actually broadened the group of providers and modified some of the benefits of this program, allowing agencies or actually healthcare providers to access necessary funds. The eligibility is to have billed Medicare claims within 180 days, not be in bankruptcy, not under investigation, and have no outstanding Medicare overpayments. Providers can actually request up to 100% of a 3-month reimbursement period. The MACs are responsible for review and issue of the payments, and that usually will occur within 7 calendar days of the request. Providers do not have to repay the advance until 120 days after they receive the money, and they have 90 days to pay back in full. These payments will be recouped from current payments during the 90-day payback period. So let's talk about some of the program considerations. Providers will receive the approved requested amount from the MAC in a lump sum, and this funds can be used for any operating expenses. So normal billing will continue, and the payments will continue to be processed. So you'll actually get the advance for the 3 months. You will continue to get paid for the current monies in the 3 months. Then 120 days after the advance is issued, Medicare payments will be used to pay back that advance. Payments will be offset until the loan is recovered and the loan is due in full within the 90-day payback period. So how to apply? Each MAC has a unique application, and you can see the areas for each one of the MACs. The administrative contractors have a slightly different variance in their applications, but each application is fairly minimal. It's only about 1 page, and it requires just minimal information. I'll show you an example of that in the next slide. We also have some information at Access in our home health solution, and I'll show you the points where you can go to that to access that information. So here's a sample request for accelerated payment. You can see it's very minimal information about the provider, including the identifiers, the NPI and the PTIN. Also ask a few questions about general cash position, anticipated receipts, anticipated expenditures, to get an idea of the cash position of the provider or agency in this case. These are all fairly similar. There's slight variances in how the form looks and just slight variances in the questions. As I mentioned before, Access has actually created a new link to an Accelerated Payment Center. You can see under Administrative tab in our Home Health Solution, there is a line called Accelerated Payment Center, and it's highlighted by the New button. Under there, the first thing that you're going to see is location. So if you have an agency that has multiple locations, you can select your location. This location controls the MAC information or the Medicare contractor's information to make sure that we're giving you the information that's pertinent to your MAC and your information that you need to file for the accelerated payment. The first thing you see is forms and resources. So this will go directly to the CMS Accelerated Payment Fact Sheet. So you can have information about what the CMS has said about the accelerated payment. It also, in the middle, shows the revenue for the past 3 months, and that is based on the collections inside Medicare's or CMS's DDE system. You can also see in the corner, you'll see a full report, so that way you can go to the report center inside Access if you need to look at various other timeframes and date ranges for your request. Pre-application recommendations, it will go and you can actually see the COVID-19 Accelerated Advance Payment request. So you can see the website for your individual MAC and what they have to say about the Accelerated Advance Payment request. In the bottom left-hand corner, you'll see our eligibility criteria. In the middle, you'll also see application information. So this will take you directly to the application information, and we've already provided your NPI and your PTAN for you to be able to complete the document. When submitting the application, we've provided you the specific MAC information, email, fax, and mailing address for contact when you're submitting your application. So let's talk about another funding option that came out of the CARES Act. And this is a Paycheck Protection Program, which is an SBA program. This loan is designed to give an incentive for small business to keep their workers. So there actually is a forgiveness component to this loan if all employees are kept on the payroll for at least 8 weeks. But the money can be used for more than payroll. It could be used for rent, mortgage interest, or utilities, basically your direct operating expenses. Forgiveness is up to 8 weeks of payroll based on retention level, and those retention levels not only include the amount of employees or the number of employees, but also the salary levels of those employees. No collateral personal guarantees on this loan. There are no fees associated with this loan, and it has a minimum 6-month deferral of payment. This eligible entities can apply if they were harmed by COVID-19 between February 15th and January 30th of 2020. So this actually will go retroactive back to February if your agency or business has already been affected. And if you had to lay off employees, you can actually bring them back, and this program will cover that. So let's look at an example of how this would work. In this scenario, this agency has about 30 employees with a monthly payroll of $125,000, and that includes not only salary and wages, but also the benefits. This organization would be eligible to apply for a loan of $312,500 or 2.5 times the monthly payroll. This loan must be used for payroll benefits, mortgage interest, rent, or utilities, so your basic operating expenses. We have seen where 75% of the loan should be used to maintain payroll, so that will qualify for the full 100% forgiveness. If it's not, it may affect the amount of forgiveness that actually will be offset against the loan. And if there is a reduction of staff and wages, so if you were only able to protect 90% of your staff, then it could affect the forgiveness of that loan. Prorated portion of that loan could be not forgiven. The terms and the balances will be 2 years at 1% interest with a 6-month deferral. So very, very significantly reduced interest and reasonable terms. How to apply? This is a link to the Small Business Association website talking about this relief packages and the paycheck program. There are some additional loans that are out there from the SBA associated with the CARES Act. We suggest that you go and do your research and understand what these loans are. Many of these loans, especially with the SBA, are not intended to be overlapping. So try to figure out which loan fits the best for you and your business. Also, we have heard through the news and other information that banks are starting to max out at their loan amount. So there was only a set amount of money allocated in the CARES Act. The government is now talking about extending that or approving additional funds. But the best thing to do would be talk to your local bank or whoever you're using for your bank. If they don't have an SBA program, I'm sure that they could refer you to a affiliate that does have an SBA program to help you. Also on the SBA site, there is assistance and guidance on understanding how to use debt to further your business. So, use those resources as you need. Also on Access's website and in our solutions, you'll see Access COVID-19 Resource Center, where we have a lot of information related to COVID-19 and the CARES Act and a lot of the provisions from CMS and changes in CMS, including some of the waivers in the operational side as well as the financial side. Also, Access Help Center, if you go to www.access.com/help, you'll see all of our resources for anything that's out there related to the home care industry. Trying to support everybody through this pandemic and making sure that we're all working together to get through. We're trying to make sure that you have the information needed to make good decisions for your agencies during this emergency situation. Again, stay safe out there. We hope to hear from you soon, and we'll be getting more information out to you as soon as we can. Thank you.
Thank you for joining our on-demand training today. Access is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at access.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Access, empowering care anytime, anywhere.